Pseudobulbar affect, or PBA for short, is a medical, specifically a neurological condition that results in uncontrolled, disproportionate or unintentional outbursts of crying and or laughing. I think it's probably important to make a bit of a brief distinction between pseudobulbar affect and bulbar affect at the start. Now, even though the two are similar and the terms are often used interchangeably, there are some key differences. Both conditions are characterised by episodes of this uncontrolled, inappropriate or exaggerated emotional expression, such as laughing or crying, which are not necessarily related to the person's current emotional state or context. Bulbar affect is typically caused by damage or lesions to the brain stem, particularly the lower parts, which we call the medulla oblongata, or near the pons. Pseudobulbar affect, on the other hand, causes episodes of emotional expression that are thought to be mostly disproportionate to the situation and due to damage or disruption in the brain's prefrontal cortex or other areas involved with emotional regulation, like the limbic system. Both bulbar and pseudobulbar affect can be caused by similar neurological conditions such as MS, multiple sclerosis, ALS, which is amyotrophic lateral sclerosis, sometimes called MND, motor neuron disease, Parkinson's disease, stroke, tumours, and neurodegenerative diseases, which are your dementias. But the main key difference is that they impact different parts of the brain. Additionally, pseudobulbar affect may also include some other symptoms such as mood swings, irritability, and depression, which are not typically seen with bulbar affect. We can break the term pseudobulbar affect down and understand it a bit better by the three words that comprise its title. So pseudo is a prefix that we apply before another word, usually to imply that it's fake or it's in place of a bit of a deceptive title of the next word. And in this case, the next word being bulbar, which relates to that medulla bulb in the brain stem. So by putting pseudo and bulbar together, we're essentially implying that we have a bit of a fake bulbar affect, a type of condition similar to the original, but not actually, because it's impacting a different part of the brain. Now, the main word in this is affect. This is the most important part of both conditions. So if we think of affect, what we're doing is we're looking at the behaviour on the outside. It is different from mood, because mood is what we feel on the inside. It's the experience of emotion, where affect is how that is then displayed to the outside world. So in PBA, the connection between mood and affect is broken. So affect then is not necessarily a reliable indicator of the person's mood. So a person with PBA may cry at something that's funny, they may laugh at something that's sad or inappropriate. We can't infer one's emotion from the affect or from the behaviour that we are observing. And that is the common factor of both PBA and bulbar affect. Now, that can be confusing for loved ones of someone with PBA because they assume that what they're seeing is what their loved one is feeling. And if their loved one is crying, they will assume that they are sad, but it's often not the case. My mum had pseudobulbar affect as a secondary symptom of frontotemporal dementia, FTD, and watching her for several years just crying at everything was really hard to take. The way that I got through that was to understand what PBA is and how the brain is impacted both through dementia and through PBA. And I was able to separate the emotion from the affect and the behaviour. And in time, I was okay with it. I understood that my mum isn't sad. This is the only way that her brain's allowing her to process emotion at all. So sometimes I would go and visit her and I knew she was happy to see me, but she would break down in tears. She would look distressed, or sometimes she'd just cry for no reason. It was really hard watching my mum go through both dementia and PBA. There are some pharmacological interventions. Nuedexta is a medication that has been approved for the treatment of PBA. It combines two drugs, dextromethorphan and quinidine, and they work together to reduce the frequency and the severity of the PBA episodes. There are selective serotonin reuptake inhibitors, SSRIs. These are typically antidepressant medications like Prozac, Zoloft, Celexa. tricyclic antidepressants. These are our older antidepressant medication groups like amitriptyline, Elavil, or other medications that have been used to treat along the way, such as antipsychotics, risperidone, olanzapine, carbamazepine. But what I tend to prefer to use, if possible, and maybe not as much evidence, or maybe it's not as popular, I think the evidence is there, is low-level light therapy, also known as photobiomodulation therapy or cold laser therapy. It's a form of medical treatment that uses low-power lasers or light-emitting diodes, LEDs, to stimulate healing, reduce pain and inflammation in the body. It has been shown to help with musculoskeletal pain, joint disorders, skin disorders, and most importantly, neurological conditions. Low-level light therapy is something I use in my clinic now. I didn't when my mum was going through this condition. I didn't have my clinic established then, but it is important for me now to be able to share this information, to share therapies and to support people as they go through it, because PBA and or dementia, the two combined, it's just a horrendous combination, but either or is difficult, and it's a horrible experience for the loved ones to go through. So if you have someone with PBA, speak to your general practitioners or specialist providers and ask for help, because we shouldn't have to do this alone. Lots of love to you and your families. Take care of yourselves and each other, and I'll talk to you again soon. Bye for now.